So, good. We have a question down the back there. Down there? Microphone coming?
Yeah.
Got a loud voice? No?
I have a loud voice.
Okay. If you could just introduce yourself as well. Thank you.
Hi everyone, I'm Kate Byrne from the Fibre Project. My question's for you, Colin. Thank you. There's been a lot of media hysteria around the cases in the US of people having issues in vaping. Can you just please explain to us what your understanding is of what was the cause of those deaths?
Thank God someone's asked that. Is this working? It's got a red light, I suppose. Yeah, I'll just speak into it. Is that working? Oh, it's working. Okay. Yeah, look, thank you for asking. Look, this is a moral panic created and exploited by people who are opposed to vaping nicotine. The evidence is increasingly clear. We don't know for certain, but in every case which has been identified, where the cause has been identified of a vaping-related lung injury or death, the contaminated THC has been the cause. There hasn't been one case that's been linked to nicotine. And this outbreak has all the hallmarks of the pattern of an illicit, the release of a bad batch of illicit drugs. It hits the street, breaks out in clusters amongst young people in certain areas. It's nothing to do with nicotine vaping that people have been doing for 10, 15 years. And unfortunately, even our chief medical officer has exploited this to frighten vapers away from vaping.
Thank you. Thanks, Colin. Okay, more questions? I'll just channel Tony Jones here. I'll take statements as well. Yes. Yes, hello. Yeah, in front.
Yeah, I just wanted to add to that pretty much every state in which this has occurred have been states where marijuana is illegal. They haven't occurred where there's a regulated market.
Thank you for that clarification. Yes.
I've got that voice, okay.
Thanks. Thank you, Steph.
My question is to Adam, just to tie what else we've spoken about. What role do you see a lack of leadership from the government in regards to drugs and alcohol? How much of a role does that play in the work you're trying to do in the Northern Territory, which I think would be applicable to every state in this country?
Yeah, great question, Steph. Thanks. Look, yesterday I was sitting at Me Watch Health, which is at Nhulunbuy, and I was seeing a tobacco presentation which wasn't done in language, which the kids all speak language, probably only just get around English. I go to many communities where the health workers turn up, but it's a shame job to go over to those workers. We're not doing it, we're not creative about the way we get into communities. We're handing out flyers, brochures and some things that you can play with and squeeze and we think it's brilliant. No. How about we actually go out and create some amazing performances that highlight a discussion, that are fun, that get the community laughing, that's thought about in the way that that community sits around together, go to the place and sit with the elders and talk about that. You know, there's so much work we've got to do, but we've all got to go back to grade 1 again and learn about how we best do this work. Because the communities are crying out for help, but they're not getting the right type of help. It's like dropping houses into communities that I see so often get dropped in that are so architecturally stuffed because they aren't built around the needs of the people in that community because no one bothered. There's not going to be a white paper that fixes this stuff. Each community is different. Let's spend time in each community and not just have a bit of white Toyota dreaming and just turn up for 2 days and then disappear in our suits. So,
Thanks, Adam. Just to push that just a little bit further, because the question was about, I'm channeling Tony Jones here. The question was about government policy here, and that's very important because of the leadership role, obviously, and more importantly, the allocation of resources to this. So you presented quite a radical alternative based on the importance of relationships with communities. And it strikes me that there's been a great disappointment in some circles around closing the gap, and the fact that although there has been some gains made, there's still a long way to go in improving, in reducing that gap between white Australia and Indigenous Australia. So to bring that even further, what's your view about what are the more creative and radical policy changes that might be possible to implement by government or supported by government?
Look, all I know, and this comes from someone who's just out there doing the work, is we need to start to, like I said, listen to the ground. So the first one for me is, I actually believe let's get to the people and spend time with the people, but not just have a token visit. That's what I'm saying. So one problem I have at the moment is youth detention centres. So Dondale, for example, I don't believe we should close Dondale. Everybody says there shouldn't be youth detention centres. Let's get the kids going so well with our wellbeing programs. It should be a part of every day, getting up and doing your 40 minutes of fitness or whatever, and your 20 minutes of getting fit on the inside. Let's do that instead of build these mass detention centres. Let's do the preventative work. That's the stuff I want policy around, is making sure the prevention programs are brilliant. I don't know enough about policy. Now, if I don't know enough about policy and about creating policy, have a guess what the communities that I go to think about your policy. So what I want you to do is start to build some structures that are actually easy for the layman, the person that's on the ground doing the work, to understand, so we can start to shape a society that talks together, communicates together, and gets rid of status.
Thanks, Adam. Okay, over here.
Hi, this is a question for everyone on stage, and what we're seeing particularly now in the harm reduction communities is that the government probably isn't as swift to act as much as we think they should, as quickly as we think they should. There's many optical reasons and everything else for that. And all three of you have been on the ground, fighting a very hard fight for quite some time, and you're probably, a little bit beaten a bit, and now a bit more dealing with reality. And I just wanted your perspective on, in terms of a pragmatic approach, how much should we be focusing on really pushing for 100% or willing to work with the government to accept, is 50% of something better than 100% of nothing?
Over to the panel.
Most of us here watch people die all the time. They die 100%.
Yeah.
I think we need to ask for 100% of what's required.
Yeah.
And there's international examples of what works really. You can look at Portugal, there's complexities to it, but it's way better than what we see here. Currently, I follow some of the stuff that happens in the UK and Scotland. They've got a real mess on their hands in the prison system. Scotland, the death rate from heroin is significant. That could be with a few supervisors injecting 100% or more than one facility. So we should make the ask, and for every ask we make, we save lives.
Anybody else like to take away?
I have spoken to Greg Hunt and Chris Bowen, and I don't see a lot of promise there. I think we should ask for 100%, but we might have to settle for less. And I think in the interim, the less being realistic and pragmatic may be all we can get. But I think we should ask for 100%, and I think we should make as much noise as we can to get that.
Thanks, Colin. More questions? Comments? Yes, back there. Robbie?
I've got a question for all the panel, I guess, about Indigenous communities and whether they actually have harm reduction strategies built into them. I mean, I have heard that American Indians have been smoking tobacco for a long time and never heard them much, so I don't know about that. But I mean, if we have an Aboriginal culture that goes back 50, 60,000 years, did they use, drugs, and did they have inbuilt in those in their societies? I mean, I once smoked a joint with some Aboriginal people in Newlai in 1969, and I did ask them this, and they didn't really have an answer for me. They didn't say that they had used things like that before, even though they were smoking grass in the late 60s. So,
yeah, I'll just make a couple of comments and hand it to the experts. But And smoking has been a traditional part of recent Aboriginal culture. It was introduced in the 1700s, I think, and it's been used mainly for ceremonial purposes before that. The gap in smoking between Indigenous and non-Indigenous people has not dropped for 20 years. We're always talking about reducing the gap. We are not reducing the gap. Our organisation has approached Aboriginal people, adults have a smoking rate of 45%, which is a national disgrace. Our organisation has approached a number of key Indigenous leaders and organisations that have shown no interest whatsoever in tobacco harm reduction. Because I think there are political issues there, and funding and so on. So we would love to, if you have connections, we would love to explain this to them, but we cannot seem. We want them to own the whole project. We don't want to run it for them. We'd love to, we've prepared the document information. We'd love them to run it, but we cannot seem to get interest.
Thanks, Colin. Other panel members?
Just a couple of things I see in community. Chewing tobacco. So we push tobacco, which gets chewed a fair bit, especially in the desert community. Up in Nhulunbuy and on the homelands. Now, the homelands, they're quite traditional, so they got taken off. Whoops, there's the water. The Yirrkala, they got taken off Yirrkala lands because they didn't want the alcohol influence. So communities like Gungun, Darlingboy, Wundawoy are communities that are still very traditional without any of those influences. So we don't see much smoking on community. So the elders have made a real lead to pull them away from where the influence of alcohol and cigarettes were. The other thing that is really sad that we see, especially with kids in Dondale and in other communities, is choking themselves off to get a high and a buzz. So you'll see the shirts get pulled tight, asphyxiate for a second, and then get the air back, so they're going for that buzz. What I'm interested in is why are we escaping? What are we escaping from? Can we make this world a better place so you don't need to do that to get that buzz? So there's just a couple of things I've seen.
Thanks, Adam. Sam?
I really think, I'm not one for me to be saying things like, we need to drain the swamp, but Canberra's involvement in the Northern Territory is an issue. I think that Darwin's involvement in the Northern Territory is an issue. The communities themselves need to have the capacity to work their solutions with all the support. You need 100 of these guys running around. Why is it that in Dondale, I was talking about it before, I asked them how many of the officers in there were Aboriginal. Wasn't the majority. I think it's white man imposition continuously is making the issue more complex. So I know the alcohol and drug space, and I'm not saying counselling is the thing for Aboriginal communities, but if you look at the provision of services in the Northern Territory, in a state that is probably larger than, Scandinavia or something like that, you'd be lucky to count 30, and they're supposed to deal with that complexity. Where's the billions gone? Into the bureaucracy in Canberra?
Thanks, Sam. Okay, more questions. Yes? You can have a second one. You can.
That's allowed.
Yes, that's allowed.
Just in regards, I guess, in answering your question in terms of, you mentioned the use of tobacco with Native American people and not having issues around, smoking or addiction. I think one of the reasons for that is that it was, used in ceremonies. So it was very strict ritual and ceremony around the use of the drug. And ritual is actually a protective factor against drug harm. And so there are things that can be learned. And I guess, you could, encourage people to think about ritual. So, for example, for some people, their ritual might be, I only take MDMA when I go to my favourite festival once a year. And that ritual, and I do it with my friends, and we all sit down together, and we think about what we want to get out of the experience, and we take it together. So that can be a protective factor.
Thank you. Yes, gentleman here.
I've got a lot of from students who Centre for Drug Policy Australia. I just want to follow on the question. I do know of, you were asking about what the existing use of drugs was amongst Australian, so-called Australian Indigenous people. There was definitely use of patchouli, which is it's kind of like a form of tobacco that wasn't used pretty widely. So it's definitely there was use. I'm not sure about what harm reduction practices they would have had, but I think the fact that we don't really have a conversation about how drug use is innate to our society, that might be the kind of area to look at. So I think it's a really good question you've got, is like, what harm reduction practices did exist and how have we managed to kind of trample over the top of them?
Thank you. We've got time for one or two more questions. Yes.
Could I start with a wonderful quote from Adam, that we should deal with people at the point of need rather than the point of crisis? Very, very good quote. Thank you for that. Sam, your slide on people coming out of prison and then overdose deaths, which is very, very challenging slide for public policy makers. What's missing in the prison system here that could deal with people at the point of need rather than the point of crisis, do you think?
Look, what they do in overseas jurisdictions like Norway and Holland, they're actually planning for the exit when they go in, and they're sorting out their accommodation and their AOD needs and their dosing, doctors' health and support needs. So that's all in place, and that leads to much greater success. It drops the recidivism rate, and therefore you have less need for investment at that end. You put it at this end, it rebuilds the system there. Those figures are shocking. I'm not one that's shy of going to the media or saying, look at this. When I took it to The Age, they took a week and a half and they said, well, there's nothing special in it. That's what you'd expect. I was absolutely shocked. I was flabbergasted. Herald Sun ran it. Based on that, I get calls from the departments wanting to engage about our new common client project. That's fantastic. It's all about new community safety. I said, well, it's actually human rights, the right not to die. So there's a whole range of issues that happen in the prison system itself. Lack of preparation on exit, lack of investment on exit, which creates that whirlwind that takes all those people back into the system, and an ever increasing growth.
Terrific. Thank you, Sam. That's all we've got time for. So I want to, first of all, thank this wonderful panel. Thought-provoking and very authoritative. Thanks to all. We're going to have a 10-minute break.